Hello, and thank you for the opportunity to share information about the interplay of housing, health, and aging. My name is Alana Knudson, and I direct the North Wall Center for Rural Health Analysis, which is located at the University of Chicago. There are many different ways to look at rural communities. We often think of rural in the context of farming, agriculture, or great land space, but we also see rural in terms of recreation and the places we like to go to get away from our worries and work in urban areas. At our Rural Health Resource Center, we talk a lot about why rural should matter for you. And rural areas are not only the source of much of our food, drinking water, energy production, and outdoor recreation, but 1 in 5 Americans live in rural communities, including a disproportionate number of veterans and active duty service members, making the study of the health needs and challenges of rural Americans essential to us all. And we often talk about the importance of the interdependence that we have between rural and urban communities. We oftentimes were asked, why should rural areas matter to you? Rural areas are not only the source of much of our food, drinking water, energy production, and outdoor recreation, but 1 in 5 Americans reside in rural communities, including a disproportionate number of veterans and active duty service members who live there, making the study of the health needs and the challenges of rural Americans essential to us all. At the Wall Center, we often talk about the importance of the interdependence between rural and urban communities. We need to have strong rural communities and strong urban communities to have a strong and economically viable country. There are numerous ways to categorize rural, and there are at least 72 different federal categorizations. And I'm just going to briefly touch on 3 of them that you may be familiar with. One way of categorizing rural communities is based on the Office of Management and Budget, which looks at micropolitan areas as being 10,000 to 49,999 people, and non-core areas are the smallest of rural areas, less than 10,000. And this is often the way it is presented in many of our studies. We also use what's called RUC, or the Rural Urban Continuum Codes, and these again are based on OMB data, and there are 9 different classifications. You may have also heard reference to urban influence codes, where there are urban codes and everything that is not urban is categorized as rural or non-metropolitan. So there are many different ways, and depending on which definition you use, that provides insight as to how our different populations are counted and the areas of the country that fall under these different categorizations. One thing we stress at the World Center is that we look at rural America through the lens of assets and strengths. And we often use this framework as a way to be able to connect with rural communities, looking at not only the individual assets of the people who live there, but also looking at those organizational assets that are in rural communities, as well as those community assets, and also considering those cultural assets that are near and dear and really define our rural communities. I have been to rural communities across the country. They are very different, be it Appalachia, the Delta, the Pacific Northwest, or my home area in the Great Plains. So where should we begin? And when I talk about anything to do with housing, rural, and aging, I always stress the importance of meeting people where they are. And this really brings us back to Maslow's hierarchy of needs. When we're talking about housing issues in particular, we're talking about that foundational need that people have in order to live healthy lives. And this all begins with social determinants of health. And as you know, there are a number of different definitions for social determinants of health, but I often use the healthy people definition that really talks about the conditions and environments where people are born, live, work, play, worship, and age. All these different conditions really contribute to the quality of life. And for our discussion today, we're really going to focus on that neighborhood and built environment. And as you see, the neighborhood and physical environment includes housing and transportation. We can't talk about housing without also speaking to transportation. One of the foundational considerations when we're looking at anything in rural America is with regard to employment and poverty. And I just bring this to your attention to show that rural poverty since 2000 has never been less than urban poverty. We continue to see trends that are mirroring each other in terms of where the different spikes occur. We can definitely see where poverty went up after the financial challenges of 2008 to 2010, 11, and the echo effect of that with regard to poverty. But it's important to point out that we have never been able to get rural poverty below urban poverty. And likewise, our rural unemployment, until just in the recent past with COVID, has also outpaced urban. We also see across the country different display of where poverty occurs, and the darkest counties that we see in the particularly the West are areas where we have American Indian reservations, and in the South, we see darkest counties in rural for the Delta and also Central Appalachia. Other counties are spread across the country. A consideration that we also have is persistent poverty, in which many of these that are the darkest color have had poverty over 20% in their counties for over now 40 years. The opportunity to have safe and affordable housing is indelibly linked to not only poverty, but also to employment. And as we're thinking about how people are preparing and if they are age ready, we see that different parts of our country are more prepared with regard to their housing to be able to support people aging in place, if you will, making sure that they have first floor access, for example, to a bathroom, to a bedroom, to ensure that they have a working kitchen and good plumbing. And as you can see, about 10% across the country are age ready, and we have somewhat fewer housing options in the Northeast than in, for example, the West that are adequate if we look at that age ready criteria. We also know that there are different types of structures. And one thing to note, the darkest bar relates to our rural and small towns in this particular graph. And as you can see, single family detached homes are most prevalent in our rural and small towns, but we also have the highest percentage of mobile and manufactured homes. And that is important consideration, particularly when we have an increase in extreme weather events, such as tornadoes, flooding, and hurricanes. And also, those types of housing are often not as durable as other, for example, frame-built homes. We also look at different ways of addressing rural urban housing with regard to crowded housing. And my colleagues at the University of Minnesota's Rural Health Research Center recently published some policy briefs that provided some information about crowded housing by race and ethnicity. And as you can see, the highest reported crowded housing was for urban Latinos, but in our rural areas, the highest pertained to American Indian or Alaska Natives. When we look at the length of time of living in homes, by far we see rural are the most likely to live in homes for more than 20 years. This has some positive and negative features to it. On the positive side, there may be a greater connection to community. On the negative side, there are more opportunities for unmet housing needs with regard to housing improvements and maintenance. We also look at disability, and what we find is that people who live in rural, and again, rural is the yellow bar, we find the highest percentage of people living in homes that are over 20 years, they either have a disability or they report fair or poor health, or they have both fair poor health status as well as living with a disability. And again, this can be very challenging, particularly if the housing environment does not provide that safe categories, for example, main floor bathrooms and bedrooms. We also look at incomplete kitchens as a way to assess whether or not houses are uh, appropriate for rural. And what we see here, the darkest bars represent disability. The darkest orange bars are rural with disability. The dark purple are urban. And as you can see, even though these percentages are smaller than in the previous slide, incomplete kitchens are more uh, of an issue for those with disability than not. And we also see that particularly for rural areas, incomplete kitchens and not even having stoves or refrigerators are particularly challenging for rural overall. One example of why this matters and how it relates to health, of course, we need kitchens that we can cook food and be able to store food, but also we need to have refrigeration. Many of the medications that people rely on, particularly with regard to insulin, need to be maintained at an adequate temperature that requires refrigeration. And if we don't have kitchens that provide this, it provides challenges. And we at my center have helped people navigate to find options. We also see some issues pertaining to incomplete plumbing. And I just want to call your attention to the purple bars on these different indicators uh, that relate to incomplete plumbing overall. And in rural, you can see by far American Indian or Alaska Native homes are the most likely to have incomplete plumbing. And of course, this pertains to health and well-being with regard to hygiene and making sure that there's a place for people to wash hands. You will see it relates to having showers for body hygiene as well as no hot water. And again, these are central to being able to maintain health, especially as we grow older. Another issue to consider when we're looking at rural areas pertains to seasonal and recreational homes. And although some areas in our country have an abundance of homes, some of those areas are located in areas that have high seasonal and recreation, such as in the mountains for skiing or near lake country. And those actually are deterrence for being able to find affordable housing for people who work in those communities. Oftentimes, areas that have the highest seasonal vacancies also have the highest cost of living. And for people who work, for example, in the service industry, they must commute from a long distance. And that's why we talk about transportation, because housing is linked to transportation. And even though, as I mentioned, about 1 in 5 Americans live in rural areas, about 2/3 of our nation's total lane miles are located in rural areas. Even though urban areas have about 1,000 lane miles per 100,000 residents, it is almost 9 times that for rural. And with that, we also see a great difference in the fatality rates between vehicle miles that are traveled. And overall, 43% of highway fatalities occur on rural roads. And again, that creates some disparities. And because housing, available, affordable housing dictates where people live, Many times people have to travel great distances, not only for employment, but also especially to access any type of tertiary or specialty care. And this can be quite problematic for some of our older adults residing in rural and more remote frontier areas. And as we look across where we see the highest proportion of rural older adults, you can see on this map where the intensity of the um, over 65 age population lives. And again, some of these areas, such as Montana, you have to go miles and miles to be able to access, for example, specialty care. Also, some considerations when we're thinking about access to care. As I said, transportation is an issue, but so is actual access to rural hospitals. And this slide depicts where we have seen a number of rural hospital closures. There have been 194 rural hospital closures and some conversions since January of 2005. You can see a lot of these have been concentrated in more of the eastern part and uh, south part of the country. And this again creates challenges when people are looking at where to reside, because many times aging in place decisions are related to access to healthcare. And so as we are looking at where these closures are occurring, and there was just an announcement of another closure of a rural hospital in Kansas just today, it will continue to influence and affect decision making where people reside. There are many opportunities that we talk about in looking at rural health. And one of the things we've been talking about is imagining rural communities. And as we are thinking about drawing upon strengths and assets, one of the things that we look at is creating more jobs with livable wages, including health insurance and addressing mental health issues. But I want to take you down to the bullet on supporting aging in place. And in order to ensure that we're able to do that, not only do we need to have adequate housing and transportation, we need to have home and community-based services available that include home health as well as personal care assistance. And then, of course, making sure that we have transportation. And one of the primary goals of many of our rural communities is to build more affordable housing and look at that housing in the lens of ensuring there's a place for older adults to live. These last slides, I'm going to zip through them. They are resources for you. I want to make sure that you are able to access information. First of all, our team at NORC with our colleagues at East Tennessee State University have developed several mapping tools, and these tools will provide important information for you. If you're working on a story in a particular part of the country, you can go to all of these different tools and be able to hone in and get information at the county level. One of the things that these tools have been designed is to help with local planning efforts, as well as to provide data for advocacy or grant development, and also as a way to bring people together. It also provides some really great opportunities to understand not only the assets and strengths in a community, but also to look at some of those deficits. For example, if we see areas where we have higher, for example, opioid use. There are a number of different topics that can be assessed through the tools, and I've just outlined those so that you can go to the tool that you are most interested in. I know we were going to talk about health outcomes, but I thought you being able to identify what information you need and go directly to the tool, it will get you there. We also include some important information about that socioeconomic and community data, as well as overdose mortality, substance use, and the like. With regard to health outcomes, you can go to the tool and click on anything from COVID-19 to the leading causes of death. Again, looking at it by county, you can search all the different types of outcomes that you would like to be able to look at overlays. For example, if you want to overlay with sociodemographics or economics. This is just a quick example of cardiovascular disease mortality. You can hone in, as I said, on a state, and then you can click and find information on that county versus the state data and how it compares with the national data. Again, I think this would be very helpful if you are looking at developing community stories where you can get down to that community level data. Again, you can identify whatever data you would like to look at and pull out the information that is most pertinent to your stories, as well as access to healthcare. The food environment, food insecurity is an important measurement. And as I said, we also include overlays so that you can look at, for example, household income. You can look at pretty much any indicator that you are interested in, including our reservation lands. You can also look at states if you want to just pull out the data for the state. Then moving on to the next resource, on the Rural Health Information Hub, we have all information available. Social Determinants of Health for Rural Communities is a toolkit. They're all designed in modular format. Each of these toolkits also has programs that have been successful in rural communities. Likewise, we have a number of different topics should you have an interest in a specific topic for your stories. And one of the important tools that often people wonder about is, am I rural? This is another resource available on the RHI Hub, and you can look to see whether or not the address, town, zip code, or county registers as rural, depending on the definition, and many definitions are provided. There's also a wonderful project looking at different types of resources brought together, including looking at how to bring housing resources that pull together the Federal Reserve Banks, CDFIs, philanthropic organizations, as well as rural leaders across the country. And lastly, our Rural Health Equity Research Center is a resource for you. And if you have any additional questions, please contact me. We are here to provide you whatever resources or information we can to be able to give you a complete picture of what is happening in our very innovative and vital rural communities. Thank you.